Thanks for joining us today. We're going to go over the tibialis posterior. So first I'm going to show the assessment for tibialis posterior. We'll look at the quality of motion, look at sequencing, and then we'll actually go and palpate the muscle, and you should see a difference in range of motion. Also, you should see the muscle react when we ask her to turn the foot in. We should see the lower leg turn in really well, and of course you should see the foot turn in really well, and then see the arch throughout the foot created through the pull of the muscle. So I'm going to first show you that. So we're going to bend the knee here on the left side, put the foot in this position, and then ask her to, first of all I want to see that knee in this position, so it would be like a slight abduction of the leg at the knee joint. And then she's going to turn the foot in, and you can see for her a couple things there, and I'll show it again, but there was a lot of effort for her to get into the position, and then you kind of saw the foot kind of settle in right in through here, and the lower leg really didn't rotate in well. So we'll look at it one more time. The knee, we're going to look for that slight abduction of the lower leg at the knee joint, and then just turn the foot in. Okay, so it's kind of hard to see, but there's a lot of effort to get into that position, and then just push the big toe down onto the table, and we should see a little bit more arch here. So when we go back and palpate the muscle, we'll go back and check range of motion here, and you should see the foot turn in a lot faster and the lower leg turn in a lot faster, so everything's reacting a lot faster. One more time. Turn the foot in and point that big toe, and a lot of times the muscle will actually cramp there as well. Okay, so we'll come out of that, and now we'll go to the palpation. So I'm going to have you turn over, please, and put a little bolster in here. Okay, and just to give you an idea of where we're going to be, I'm going to come right into the medial side of the fibula here, and I'm going to stay right on the posterior side, right in through here. Okay, so we're going to palpate right in through there on the medial side of the fibula, but on the posterior side of the fibula. That's really important. So, like, just as an example, this is soleus through here, so we want to be more in through here, which this skeleton doesn't show. Okay, then we're going to come over to the lateral side of the tibia, and we're going to focus on the posterior side of the lateral tibia, so it would be right in through here. Okay, then we'll go down into the foot. Well, actually, first we'll hit the medial malleolus, or the posterior side of the medial malleolus, so that's going to be right in through here, and the tendon of the tibialis posterior will be the most anterior, or the closest to the medial malleolus. So of course we know Tom, Dick, and Harry will be coming through here, and Tom is the most anterior. Then the muscle will follow the muscle right onto the calcaneus here. So the landmark is called the sussinaculum tali. Okay, sussinaculum tali, so it's going to be right in through here. We're going to palpate there, and then ultimately we're going to go over to the navicular. You can see this blue area here. We're going to palpate in through there, and then we'll follow the tendon onto the first cuneiform here, so we'll be right in through here as well. And then the muscle, the tendon, is actually going to go over to the cuboid as well, so it's going to be right in through here, and then it will ultimately be on this second cuneiform, the third cuneiform, and then you can kind of see the second cuneiform is hidden in there, but we'll ultimately get in there as well. I don't know if you can see that in there. So we're going to hit that second cuneiform, and then ultimately the third cuneiform. We'll get on to the second, or the base of the second metatarsal, so through there, and then here, And then ultimately we're going to get on to the fourth, or base of the fourth metatarsal as well. So the base of the second, third, and fourth metatarsal. Okay, so you can see there's a lot of attachments throughout the plantar side of the foot. Believe it or not, there's actually 9 attachments there, and we want to address all those attachments. Okay, so that's going to make a big difference on the ability of her to use or utilize that spring throughout her arch when she's running. So we'll first feel for the head of the fibula, and then we're just going to come on to the medial side of the fibula, and like I said, we're going to be right into that posterior surface, and this can be pretty sensitive. And I like to add that little flexion of the leg at the knee joint by putting the bolster in there, because it allows you to easily find the head of the fibula. And then of course just follow the shaft of the fibula down, just staying on the posterior side of that. So this can be pretty sensitive. Okay, so now we're going to come down a little bit more here, staying on that posterior side. And just always feel for, where you are in the fibula, because if you really look at the fibula, there's a lot of twists, or where the bone rotates on itself. So you want to make sure you stay right on that posterior side of the fibula. This, like I said, this can be really sensitive, so this is sensitive for her right through here. And I usually go down to where the lateral head of the gastroc would begin. Just going to retrace my path here, staying right on that posterior side. Okay, so that should be pretty good through there. Now we're going to go on to that tibia. So like I showed before, you have to go right over to the head of the fibula here, and we're going to follow kind of the tibia here, the posterior side of the tibia. And of course you have to imagine that the muscle, the tibialis posterior, is attaching to the interosseous membrane as well. So I'm going to come in right in through here, kind of where that tibia meets the fibula, and you can kind of see the angle here, and just compress in there. And this can be really sensitive. Now I'm kind of getting a little closer to where those attachments actually are. It takes a little while to kind of find your way once you get in here. And of course you have to be sensitive when you go in there, because it can be really tender, and we don't want the
the muscles to contract. Okay, so now I'm definitely on that posterior side of the lateral tibia. And of course we'll be getting some of that interosseous membrane because the muscle attaches to that interosseous membrane that runs between the two bones. And again, I go down to where the medial and lateral head, kind of approximately where they meet that Achilles. It's going to be real sensitive right through here. So you want to make sure when you're in there that you're feeling for the bone. So we're feeling for the lateral aspect of that tibia, on the posterior surface. Usually a lot of burning in here as well. Okay, so I'm just going to go in here for a second with a thumb, make sure I get that. Okay, go back up here real quick with a thumb. It's going to be pretty sensitive right through here. So I'm just easing in there as much as I can, but you can see how deep I am. This is probably one of the more sensitive muscles with palpation. Okay. That should be pretty good through there. Now we're going to go down to that medial malleolus. And what we can do here, if we need to, you can see how her calcaneus is kind of naturally inverted slightly. But if you need to, you can invert a little bit just to get onto the, I'll actually take this sock off, onto the medial malleolus there. So I can just shorten or invert the calcaneus and get right onto that posterior surface of the malleolus there, and you can definitely feel the tendons there. So again, Tom, Dick, and Harry will be running through there. So again, we're going right into the posterior malleolus, and this could be pretty sensitive through here. Okay, so that should be pretty good there. Okay, so now you can palpate the muscle as it comes onto that calcaneus there, but I'm actually going to have her turn over and do it that way. So we'll have you turn over there. So I'm going to do this in a supine position. I prefer to do it that way. But we'll first go right on to that, like I said, that sustenaculum tali, so it's going to be right in through here. So we'll start there, we'll go on to the navicular, and then the first cuneiform. So come right, imagine the muscle is coming off the medial malleolus, which is right here. It's coming off the posterior side, and then it's going to come right onto that sustenaculum tali of the calcaneus. So if I do a little inversion, eversion, I can kind of feel for that, and then I'm feeling for the tendon, and it's a pretty big tendon, and it's right, I don't know if you can kind of see the depth there, but it's right there, and I'm pushing it or compressing it right into that landmark on the calcaneus, and then of course I'm getting that friction or circular friction. So I'm following it all the way around. I dissected this muscle, and it turns out that it pretty much attaches all along this calcaneus, or the landmark on the calcaneus. So I try to follow it all the way onto the navicular. Okay, so now pretty much reach the end of the sustenaculum tali, and you can see I'm inverting the foot there. I should have said that. In order to get in there, and really I'm inverting that foot to really get up into that sustenaculum tali. So now you have to imagine the talus. Okay, so the talus is going to be above the calcaneus, and we're going to feel, see, so the sustenaculum tali is here. You have to imagine that the talus is right in through here. So then we're coming right on to, so here's the talus here. Now we're coming right on to that navicular, which is going to be right here. So that tendon's coming across and then right onto that navicular. So again, I'm going to do some inversion here, and we're going to go right onto the plantar surface of that navicular. And again, there's a good amount of attachment there. It's a little off on that skeleton, or the foot of the skeleton that I showed you. So really just feel for the tendon more so than looking at the where the the bone is actually showing the attachment. Okay, so you can see how much better I can get in there when I do that inversion of the foot. And I actually like to get right in between kind of the joint line between the navicular and the talus, which is right through here. And that can be pretty sensitive, but I find you get a better result when you do that. That's actually true for the foot and also the hand. I find if you can get in between the joint or into the joint line, you actually get a better result. Okay, so then we're going to follow that navicular all the way up to that first cuneiform. So now the first cuneiform, I'm going to push the tissue out of the way here, is going to be right in through here. So now you can imagine, we said the navicular is back here. I'm going to follow it up right onto the cuneiform, which is right here. So this is the posterior, I'm sorry, the distal part of that navicular, and I'm going to go right into the joint line of the navicular and that first cuneiform. So again, I do a little inversion, kind of moving the tissue out of the way to stay right on that tendon. And then I'm going to come right up onto the first cuneiform, so I'm on the proximal plantar side of that first cuneiform. And again, you can kind of feel the tendon there. You just have to make sure you move the tissue out of the way and just compress that tissue right into the plantar side of that first cuneiform, focusing right on the proximal side of that bone. And then of course getting right in, up and into that joint line between the cuneiform and the navicular. Okay, so that's good there. So now we're going to go over the muscle is going to take an angle or kind of angle over to the cuboid. So you have to imagine it's coming again from the posterior side of that malleolus, coming over to the calcaneus that we showed, the landmark on the calcaneus. So that's going to be right in through here, actually. See, right in through there. And then it's actually going to angle over to that cuboid. So we're going to go right in through here. And we want to make sure, again, I'm going to do a little inversion there to really get in there. So now we're more on the lateral aspect of the foot. And this can be pretty sensitive through here. Excuse me. So again, I'm going to do that inversion. Sometimes I'll even do a little inversion to bring it out. And making sure I get right onto that bone, right where that tendon would come right into that bone. Okay, so from there, I'm going to come up a little bit so that I'm moving more proximally. And I'm going to get right onto that third cuneiform. And that's actually pretty easy to feel. Excuse me. Spend some time in there. And then in order to get onto that second cuneiform that we showed on the foot of the skeleton, we can do a little more plantar flexion and a little inversion, and you should be able to get in there, and that's usually pretty sensitive. So we got to dive real deep to get that attachment. Okay, so we can add as much plantar flexion as we need, just pulling that forefoot into plantar flexion. Okay, so then from there, we'll get on to the base of the second metatarsal. Excuse me. And again, I like to do a little inversion there as well. And just, you can also flex the forefoot to make sure you feel the base of that metatarsal coming into your finger. And I'm going to jump down onto that second cuneiform while I'm here. One more time. Okay, so now I'm going over to the third, or the base of that third metatarsal. I added a little bit of inversion there. And getting right in to the base of that metatarsal. And again, I'll fall it right onto that cuneiform to try to get right in between the joint line there. So right where the base of that metatarsal meets that cuneiform. Okay, so then we're Going to hit the base of the fourth metatarsal. So again, we'll do that flexion, make sure we're on the base. Compress the tissue into the base of the fourth metatarsal, and again apply that friction to the base of that metatarsal. And again, we can always add a little flexion to make sure that we're getting the right angle. And I always like to do a little inversion because I find in general I can get in there a little bit more. I think that's good for that. Okay, so we're good there. Now we'll go back and do the test. So we're going to bend the knee, and right away she gets into the position so that there's a little abduction of the lower leg at the knee joint, and then she's going to turn the foot in. Okay, so you can see there's more range of motion now. Let's push the big toe right into the table there. So there's more range of motion. Let's relax there, and it was a lot easier to get in there, or get into that position. So one more time, the starting position. We'll relax for a second, and then we're going to have her turn that foot in. So turn the foot in. Good. And then push that big toe right onto the table there. So you can see she really gets a little bit more arch, the quality of motion's a lot better, and it was a lot smoother to get into that position. So if we imagine that she started at 12 o'clock, okay, she's now going to approximately, we would say about 4 o'clock, because I think she was at about, actually about 3 o'clock. So let's try it one more time. Yeah, actually I guess it would be closer to between 2 and 3, because before she was between 1 and 2. So that's pretty good. I'm going to go back real quick and palpate that cuboid one more time, and then we'll go back and test that one more time. So you can see how I'm really trying to get that inversion so that I can get onto that bone right where that tibialis posterior comes into that cuboid. Okay, that should be better there. So let's check range of motion. So we'll bend the knee. Okay, she has a nice abduction of that lower leg at the knee joint. Let's turn the foot in. Good. Okay, so you can see that's even smoother, and I would say she's even a little closer to 3 o'clock, and that's really good range of motion. Okay, you can see that nice arch that we created there, and overall the quality of motion's a lot better. Let's try it one more time. Good, and then just point that big toe. Great job. Thank you. That was perfect.